Prediabetes and the Microbiome, presented by Stephanie Swavely, Nikki Perrone, Emily Stang, and Caitlin Graham. As a group, we wanted to explore the growing area of research on the gut microbiome and its impact on human health. There have been many studies that draw associations between the gut microbiome and diabetes. There have also been many studies that evaluate the role of dietary fiber in the composition of the gut microbiome. Additionally, there are well-known studies on the role fiber plays in blood sugar management. Therefore, we wanted to dive deeper into how all of these things might be connected, but more specifically, the question of what types of fiber can balance the gut microbiome species ratio in adults that are diagnosed with prediabetes to improve insulin sensitivity. Our hope was to find a connection between types of fiber and how they may be used as a treatment strategy to improve insulin sensitivity and reverse prediabetes. We will conclude this presentation with the results from our literature review and critical appraisal process. To start, let's review some key facts about prediabetes. Prediabetes is a condition in which blood sugars are elevated but not high enough to be diagnosed with diabetes. People are often unaware they have prediabetes until receiving blood work, which makes treatment challenging. Having prediabetes increases one's risk for type 2 diabetes, heart disease, and stroke, all serious chronic conditions that often can be prevented. Prediabetes is thought to affect 1 in 3 adults in the United States, which is about 84.1 million people. You could consider prediabetes a warning sign and a call to action, because the good news is that it is reversible. In this presentation, we will discuss the causes and risk factors of this disease, as well as the role nutrition plays in its development and treatment. We will conclude with evidence-based treatment strategies to reverse this disease in hopes to prevent millions from developing type 2 diabetes and other chronic conditions.
According to the data compiled by the National Health and Nutrition Examination Survey and the U.S. Census Bureau, nearly 34%, or a third of the adults in the U.S. aged 18 years and older have been diagnosed with prediabetes or have impaired fasting glucose or impaired glucose tolerance. Among those with the condition, only about 11% are aware of the prediabetes. The age group most greatly affected by prediabetes are those aged 65 years and older, nearly half of those with glucose impairments, of which only 14% are aware of the disorder. More men than women have the condition, yet greater awareness is found among the women.
So what is actually happening in the body when someone has prediabetes? Firstly, the body's cells don't respond normally to insulin. This is also known as insulin resistance. In some people, however, beta cell dysfunction can also occur, in which the beta cells of the pancreas do not make enough insulin in response to the level of glucose in the blood. Without insulin being able to do its job and move glucose into the body's cells, glucose builds up in the bloodstream, which is the primary feature of prediabetes.
Although there is no definitive cause of prediabetes, there are several factors that have been shown to increase the risk for a person to develop the condition. Family and history and genetics do play a role in increasing the risk for developing prediabetes, but there are also a number of environmental factors that affect the condition. A sedentary lifestyle has been associated with an increased risk, as well as a diet high in processed foods, sugar-sweetened beverages, and low in fruits, vegetables, whole grains, and fiber. Excess fat, especially in the abdominal region, is associated with insulin resistance, and race has also been shown to be a factor. African American, Hispanic, Native American, Asian American, and Pacific Islander populations are more likely to develop prediabetes. Other conditions, such as polycystic ovary syndrome and gestational diabetes, are associated with higher rates of the condition. A mother who develops gestational diabetes while pregnant increases her risk to develop prediabetes after pregnancy, as well as her baby. Diet and nutrition play a large role in the prevention of prediabetes. Studies have shown that individuals who follow diets rich in plant-based foods have lower rates of prediabetes. This can be for several reasons, one of which is polyphenols, which are found mainly in plant-based foods and have been shown to have beneficial effects on insulin sensitivity. This is due to the mechanism by which polyphenols can increase glucose uptake into tissues, which increases sensitivity. Plant-based foods are also high in fiber. A diet high in fiber has been shown to decrease the risk for many chronic diseases, including diabetes. Fiber lowers blood pressure and cholesterol, as well as increases insulin sensitivity, which is the main issue for prediabetics. Fiber enhances weight loss, which is also a risk factor for prediabetes. A study done in Finland showed that individuals who ate a diet high in fiber had an increase in indole propionic acid in their blood, which is an anti-inflammatory agent made by the gut. The same individuals had a lower rate of prediabetes. Highly processed foods and sugar-sweetened beverages are associated with an increase in weight and a risk for prediabetes and insulin resistance.
The primary treatment for prediabetes is through lifestyle changes like diet and physical exercise, although there have been some cases where medication is necessary to treat prediabetes. The most popular medication used is metformin. This medication works by lessening the amount of glucose released from the liver, as well as increasing your sensitivity to insulin and decreasing the amount of insulin that is absorbed by the food you eat. Once a patient is diagnosed with diabetes, they will have to use a glucose monitor and in some cases may need insulin.
A successful treatment strategy for preventing the progression of prediabetes to type 2 diabetes has been demonstrated with the CDC National Diabetes Prevention Program. Research from the National Institute of Health provides supporting evidence that lifestyle modification leading to a weight reduction of 5 to 7% can lower the risk for developing type 2 diabetes. Dietary modifications include reduction in fat intake and an increase of intake and variety of fruits and vegetables that can facilitate the weight loss. This strategy also emphasizes a minimum of 150 minutes of moderately intensive physical activity per week. The lifestyle modification results for decreasing risk proves to be 27% more effective when compared to metformin treatment. Although lifestyle intervention has had positive results for slowing the progression of prediabetes to type 2 diabetes, the labor-intensive character of the process may inhibit the necessary wide-reaching implementation of the practice. A complementary or standalone therapy to prevent the progression may possibly be found by improving the nature of the gut microbe population and with a better understanding of the specific contributions of various types of fibers and their prebiotic roles. The fermentable carbohydrates, like inulin, have been found to improve insulin sensitivity in insulin-resistant individuals and normoglycemic subjects. In a random crossover trial, subjects that were diagnosed with prediabetes underwent intervention of increased inulin intake from the typical 1 to 10 grams per day to 10-gram portions 3 times a day for 6 weeks, with notable improvement of the early insulin secretion and insulin sensitivity, along with modest weight loss, as compared to the associated control subjects. The mechanism of fermentable carbohydrates' effect on glucose metabolism is complex, and with the range of various pre-diabetic states possible, there is still much research to be done. But this trial sheds light on the possibilities of greater impact on metabolic disorders as we grow to understand and improve our ability to support a healthy gut microbiome. Reference list.